Medicaid costs are putting a financial burden on Indiana hospitals, and some say they may have to take away services and in a worst case scenario, maybe even close. WRTV's Rachael Wilkerson spent the day looking into the issue. She explains what it could mean for Hoosiers in need of care.
2023's been a rough year financially. I mean, we have great culture, great employees, but it's been a struggle financially.
A struggle that's forced Johnson Memorial Health to dip into its savings, according to CEO Dr. David Dunkel.
It's disheartening when every month we're losing money. And what I told my staff is you need to contact your state representatives and let them know how much hospitals are struggling.
The reason for the financial strain, Medicaid and Medicare reimbursement.
Specifically Medicaid reimbursement. Indiana, it's one of the inpatient reimbursements, 8th lowest in the country. We haven't had an increase in our Medicaid base rate in 30 years. Imagine that, 30 years, no increase. I mean, it's amazing that we've allowed this to occur.
Medicare covers patients 65 and older. Medicaid patients can include people of any age with a disability or those considered low income. But the Indiana Hospital Association says only 57 cents of a dollar is paid back from Medicaid. That's a nearly 50% loss. IHA says Medicare pays back more than 80 cents of a dollar.
That's a problem, and it affects everybody. So the costs that need to be made up get shifted. And it's unfortunate, but that's the way our healthcare system works. Those costs get shifted to those of us with private insurance.
President of the Indiana Hospital Association, Brian Tabor, says more than 2 million Hoosiers rely on Medicaid and Medicare. He also says those with other insurance plans will continue to pick up the financial slack until lawmakers increase Medicaid reimbursement rates.
We don't want costs to be shifted over to the private sector. Medicare is really probably unlikely to change much in the short term. But we have a great opportunity with Medicaid to do what all of our surrounding states have done, which is to boost their base rates.
Hancock Health treats patients on the far east side of Indianapolis. CEO Steve Long says most people don't know Indiana hospitals partially fund Medicaid.
Medicaid is a state-federal partnership. And the way it works is that the state puts in, say, $1, and the federal government matches it in the state of Indiana with $2. So the majority of the money that actually funds the state part of the match comes from hospitals.
Hospitals across Indiana say rising costs for supplies and salaries are threatening medical services, mostly in rural communities.
It could be the closure of an OB unit, maybe a cancer service. It could be other programs. Yes, we are seeing those difficult decisions being made. We've even seen a couple of hospitals close here in Indiana.
People need to realize we cannot sustain this model with the current reimbursement levels.
Rachael Wilkerson, WRTV.
Doctors say roughly 70% of patients across Indiana hospitals have Medicaid or Medicare insurance. Starting January 1st, more mental health care providers will be able to accept Medicare. That means licensed marriage counselors, family therapists, and addiction counselors will be able to sign up to treat Medicare patients. This expansion will potentially add more than 400,000 mental health professionals to the mix, but first, they have to sign up. It's not clear yet how many new providers may join and how quickly they will start seeing patients. Check the Medicare.gov website to see what providers are available to you.